How do you treat rosacea?
Rosacea, a very common problem that we see every day in my practice. Rosacea is a condition where we see redness on the face, usually central facial redness, so around the nose, forehead, chin, and it can be accompanied with acne bumps as well. And there are considered to be 4 types of rosacea. There's the erythrotelangiectatic type, which is just straight up redness. And then there's the papulopustular rosacea, so the rosacea that gets a lot of acne bumps associated with it. There's ocular rosacea, so you can get rosacea in your eyes. And then there's something called rhinophyma, where people get like a buildup of sebaceous tissue in their nose and they get like pretty big noses. When it comes to just basic skincare with rosacea, the main theme is just keeping things gentle. Gentle cleansers, gentle moisturizers, gentle sunscreens. I recommend mineral-based sunscreens over chemical sunscreens. Brands that I really like that have gentle cleansing ingredients are CeraVe, La Roche-Posay, Avène, and Aveeno, as well as their moisturizers. When it comes to over-the-counter anti-rosacea ingredients, things I like are azelaic acid, and there's some good ones out there by The Ordinary, Paula's Choice. I also think that sulfur can be helpful. There are some over-the-counter products out there, like Amazon has some sulfur soaps, and then Vichy has one. It's the Normaderm SOS Acne Spot Corrector. This has like 10% sulfur along with like some glycolic acid and niacinamide. Niacinamide is another ingredient to look for. A lot of times you can find it in moisturizers, like CeraVe has it in their moisturizers, but you can also, look for products that have higher concentrations of niacinamide. I like ones from Paula's Choice. SkinCeuticals has one called Metacell Renewal, which is like a nice nourishing moisturizer. And then there's some other ingredients that you can look for in like redness relief moisturizers. Things like licorice can actually really help with relieving redness, and you can find that in like the Cetaphil and Eucerin redness relief cream. So there's another ingredient called Feverfew, which you can find in the Aveeno Ultra Calming line. Even things like colloidal oatmeal can be soothing too, and Aveeno has a nice oatmeal line as well. Then you also want to make sure that you're avoiding triggers for rosacea. These can include things that make your vessels dilate. So heat, stress, exercise, alcohol, spicy foods, hot beverages. In some people, things like citrus fruits, chocolate, tomatoes can actually aggravate rosacea. And something that I also find interesting, and we're seeing more studies and research coming out for this, is a correlation with rosacea and internal gut health. We see a high rate of H. pylori or Helicobacter pylori. This is a bacteria that's responsible for acid reflux. We see higher rates of H. pylori in people with rosacea. We also see higher rates of IBS or irritable bowel syndrome, as well as something called SIBO or small intestinal bacterial overgrowth. So really looking at gut health and the balance of the microbiome is something that I think is going to be the future with rosacea treatment. When it comes to conventional treatment, like at the dermatologist's office, ingredients that I often use are things like metronidazole, ivermectin, higher strengths of azelaic acid. There's also an awesome ingredient called oxymetazoline that can actually constrict your blood vessels. It's kind of like Visine, but for the skin. If you want to do an over-the-counter hack version of that, some people can use Afrin spray, and sometimes you can mix it with like a nice gentle moisturizer, like a CeraVe moisturizer, and use that to relieve some redness. And then if your rosacea is severe, if you have a lot of acne rosacea, then we will do certain oral medicines like oral doxycycline. And then for really persistent or stubborn redness, we'll use laser treatment.